Good evening, friends. Here is a high-density video that synthesizes the absolute latest medical updates, drug approvals, and guideline overvisions in pulmonology for July 2026.
The headlines: COPD management has completely shifted with the full rollout of the 2026 Gold Guidelines. Pulmonary embolism has its first dedicated precision care matrix, and massive pipeline drugs just cleared phase 3 trials. Why this matters: whether you are a clinician, student prepping for board exams, or a respiratory tech, this masterclass delivers the absolute latest clinical changes you need to know this month.
#the 2026 Gold Guidelines Revolution. The paradigm shift: COPD is no longer treated reactively.
The new guideline redefines COPD around modifiable biological activity. The goal is achieving disease stability, treating it like other chronic inflammatory conditions.
Lowered triple therapy threshold: single inhaler triple therapy, ICS/LABA/LAMA, is now the preferred next step for Group E patients. It is heavily biomarker driven based on blood eosinophil counts, BEC. The biologic era: biologics like dupilumab and mepolizumab are officially codified for specific patient profiles with high eosinophilic or type 2 inflammation.
New Rome proposal: exacerbation classification. Exacerbations are now graded strictly by clinical features at presentation, symptoms, vitals, rather than subsequent healthcare utilization.
Moderate exacerbations mandate a strict 5-day course of systemic corticosteroids. AI integration: textbooks now officially include AI-based CAD systems for case finding and risk stratification. The first ever AHA/ACC Joint P guidelines.
The precision care model, moving away from the old, blunt categories of low risk, submassive, and massive P. The new system establishes a granular A through E clinical categorization system.
The R modifier: introduction of the respiratory modifier into the FIHRT hemodynamic tracking system. This guarantees that respiratory failure and hypoxia dynamically dictate therapeutic escalation rather than blood pressure alone. Advanced therapy matrix: clearer triggers for when to bypass systemic thrombolysis in favor of catheter-directed interventions, CDI, or ECMO.
PERT standardization: the role of pulmonary embolism response teams, PERT, is now fully mandatory for intermediate to high-risk categories to reduce bedside decision delays. Breakthrough clinical trials and pipeline disruptors. Pulmonary arterial hypertension, PAH.
Ralinpag: the phase 3 advanced outcomes trial results are a massive win. This once-daily oral prostacyclin receptor agonist reduced the risk of clinical worsening by 55%. An FDA new drug application is officially slated for the second half of 2026. Idiopathic pulmonary fibrosis, IPF, and interstitial lung diseases. Inhaled treprostinil: the phase 3 Teton-1 trial met its primary endpoints. Adding inhaled treprostinil to background antifibrotics significantly slows down forced vital capacity, FVC, loss. TTI 101 and GRI 0621, emerging antifibrotic immune modulators and STAT3 inhibitors have cleared phase 2, showing actual fibrosis resolution on CT imaging. Severe asthma and COPD biologics. Tozorakimab: the Oberon and Titania phase 3 trials confirmed that this IL-33 inhibitor significantly reduces moderate to severe COPD exacerbations across all smoker statuses and eosinophil profiles. Tezepelumab: real-world data from the Passage phase 4 study proved that its TSLP blockade works universally, reducing exacerbations heavily even in smokers with concurrent mild COPD. Stethoscope: interventional pulmonology and diagnostics. Navigation bronchoscopy: major focus shifts toward early nodule navigation at the mid-year conferences. The LIA system needle biopsy: the FDA has cleared ultra-high-resolution, needle-embedded depth imaging biopsy systems. Reporting a preclinical accuracy above 95%, it provides real-time tissue verification directly within the nodule to drastically shorten lung cancer diagnostic timelines. Race-neutral spirometry: global adoption of the GLI 2022 race-neutral standards is correcting severity misclassifications. This is directly speeding up lung transplant list placement for minority populations. MAC infections and inpatient changes.
Arikase, Alice. The Phase 3 Encore trial proved that adding amicase and liposome inhalation suspension to standard multi-drug therapy drives a massive 87.8% culture conversion rate at 6 months in antibiotic-naive Mycobacterium avium complex lung disease, MACLD. Expect label expansion from the FDA later this year. Pneumonia and steroids, broad clinical implementation of findings from the Cape Cod trial. Early use of hydrocortisone in severe community-acquired pneumonia, CAP, requiring ICU admission is now standard practice to lower mortality. How has your hospital adapted to the new 2026 Gold Triple Therapy rules? What specific area from these updates would you like to expand into a detailed slide summary or script segment? More medical news snippets. More than 40% of women with ovarian cancer did not have diagnoses until after an emergency hospital admission for symptoms, a study from England found. National Registry data showed that 11,377 of 28,204 women had ovarian cancer diagnoses within 28 days after emergency admission. Diagnosis after admission occurred more often in women with severe frailty, those who were younger than 30, those ages 80 and older, and those who lived in socioeconomically deprived neighborhoods, MedPage Today. Multi-domain lifestyle intervention. A structured multi-domain lifestyle intervention may help slow changes in brain white matter associated with aging, a secondary analysis of data from the randomized Pointer trial suggested. MedPage Today. Semaglutide linkage to W.E. A systematic review synthesized findings from 6 case reports that link semaglutide use for obesity to Wernicke encephalopathy in mostly middle-aged patients with multiple comorbidities. In each case, gastrointestinal symptoms preceded neurologic decline, which was commonly marked by mental status changes and oculomotor abnormalities. Outcomes were often poor, with 4 patients developing persistent cognitive deficits consistent with Korsakoff syndrome and 1 patient dying. Medscape. Emerging research and systematic reviews link semaglutide, such as Ozempic and Wegovy, to rare but severe cases of Wernicke encephalopathy. This serious brain illness is caused by thiamine, vitamin B1, deficiency, and is typically triggered by prolonged gastrointestinal side effects like nausea and vomiting that reduce nutritional intake and cause rapid weight loss. 1, 2, 3, 4, 5. Wernicke encephalopathy is a medical emergency characterized by a classic triad of symptoms: confusion, altered mental status, oculomotor abnormalities, vision changes or eye movement issues, and ataxia, loss of muscle coordination or balance. If left unrecognized or untreated, it can quickly progress to Korsakoff syndrome, which causes irreversible cognitive deficits and severe memory issues. 1, 2, 3. Medical experts advise extreme vigilance regarding persistent GLP-1 gastrointestinal side effects. While semaglutide is highly effective for weight management, cases have highlighted the dangers of unmonitored rapid weight reduction. Because thiamine stores in the body only last a few weeks, doctors stress the importance of early diagnosis and prompt, high-dose intravenous, 4, thiamine therapy if neurological decline is observed. That wraps up our today's update. Drop a comment below on which clinical change affects your practice the most, smash the like button, and subscribe to stay ahead of the curve. See you next month. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.